but I want fun times. I want fun times. I just want to laugh.
What's up, you guys? It's your girl Tom B. Welcome to my channel. I know it's been a long time since I uploaded a video, and trust me, you guys, I have missed you. Yeah, but I've been so busy with work. You know, I'm like a frontline. I work in the hospital, and the third wave has been so hectic. So I've been so busy. I didn't have time to create. I didn't have time to sit down and plan and just like create. I didn't have the time. But this video is inspired by July being the Fibroid Awareness Month. So it'll be like a story time, but I will be more so presenting the topic to you, just sharing information. And so 4 weeks ago, I was invited to a radio program where I had to present this topic in particular, fibroids. So in this video, I will be answering questions that I was asked on the radio show, so that I have a structure, so that I have some guide with how I'm gonna drive this video. So I hope you enjoy. Let's get right into it. First of all, what is a fibroid? In simple terms, fibroids are basically just abnormal growths in the uterus. They're benign, they're non-malignant. We don't understand necessarily how they come about, but we know that there's some risk factors. For example, genetics. If your family, especially on your mom's side, or even on your dad's side, if one of them has been diagnosed with fibroids, one or three people with fibroids, you're at risk of having a fibroid. Those people who we considered who started their first period at an early age, because fibroids, what they are really, they're growths that are dependent on estrogen. So if you started your period at 10 years, you've been exposed to estrogen for a longer period, therefore fibroids will, and then if you have that genetic predispositions and then you have the fibroids that will grow because of this estrogen that's in abundance in the body. Also, another risk is that if you delay to have your first child, if you have your first child after 30, you're at risk. Then let's talk about the types. So with types of fibroids, very simply put, there are three types I'll mention. There's those fibroids that grow in the uterus itself, the fibroids that will grow around, outside of the uterus, and those that will grow in the muscle of the uterus. Three types. And then so just to look here, symptoms. Symptoms of fibroids will include abdominal pelvic pain, heavy menstrual bleeding, and painful menstrual cramps. Also, another symptom is pain during sex. Infertility is also another symptom. And the thing about fibroids, let's move to how to diagnose them. The thing about fibroids is that a lot of women will come for, a checkup or just a visit to the gynecologist, who will then assess and request for an ultrasound, and boom, they find that they're having fibroids. So it's like an incidental finding. So a lot of women will have these symptoms and think, oh, okay, pain during periods, it's normal. I'll take some Panadol, I'm okay. But really, how to diagnose fibroids is ultrasound imaging, and that's the gold standard. So who is vulnerable to fibroids? Like I mentioned earlier, women who have had their first child after 30, women who had their first period at an early age. Those are the ones who are vulnerable. Women who have a history, who have a family history of fibroids in them, are vulnerable to getting fibroids. Now, treatment methods. So a lot of people ask me, like, fibroids, do they have a cure? Do fibroids have, how can we treat it? So with fibroids, really, if a patient comes, for example, with menstrual pain, we will give you some antispasmodic medications, which will help, to reduce that uterine spasm that the fibroid causes. And another treatment method that we can give you is, like some patients who come like, oh doctor, I've bled so much, I'm feeling dizzy, weakness. And then when you investigate, you find that they have anemia. So with those patients, we put them on blood boosters. Now, so that's the medical aspect, and now the surgical aspect of fibroids. So there's procedures like myomectomy. This is where you go in for a major laparotomy procedure where they open the uterus and take out these fibroids, and you maintain your fertility. This is one option that can be done if, depending on the sizes and the location of the fibroids. Another method that can be done is uterine artery embolization. This is where they use an emboli sort of to block the supply of blood to the fibroids so that they starve it and then it starts to shrink. Another method that we can use is hysterectomy, where they just take out the whole uterus, take it for histopathology, and it's a definitive treatment for most of the women who come with fibroids and are very, very symptomatic. Now, another medical method that I haven't mentioned is that with fibroids, there's certain medicine that can stop them from growing. But they have their own side effects, because what they do is they block estrogen production. And what does estrogen do? For women, what it does is it maintains our feminine shape. It sort of like organizes where our fat goes, So what happens when you take out estrogen? You start having features of a man. This is when your voice starts to get deeper. You start growing facial hair in places where it's not supposed to grow. And the thing about this medication is that you can take it, let's say for 3 months. As soon as you stop taking it, the fibroid begins to grow. And another thing is that in Lusaka, in Zambia right now, that medicine is quite expensive. Very few can afford it, and most doctors wouldn't even offer it to you as a treatment option. They'd rather say, let's do a myomectomy, and if you're satisfied with your parity, let's do a hysterectomy. So that's that about fibroids. Now, the thing about fibroids I also need to mention is that at least 3 in 10 women have it. 3 in 10 women will be diagnosed with fibroids. Now, here goes my personal story. So for me, I was diagnosed with fibroids at the young age of 22. And I really didn't know what was going on with me. I just went to, back when I was in university, we would have like medical checkups every year. And we would see different specialists. And one of the specialists we saw was the gynecologist. So I remember one time I was like, no, my periods are painful. I'm always in pain, and I used to go 3-4 days. Now I'm going 5-6 days. And she was like, So that's how she requested for me to do an ultrasound, and boom, that's how we found that I had fibroids. So I've been living with them I'm 27 now, and every month I get a lot of pain. Like on my period, it's so painful. I literally have to take so much medication that I even get knocked out and just sleep. Sometimes it's even hard to go to work, but I have to go. I push myself, so I go. So fibroids, really, it's such a problem that nearly every woman, at least one of the girls in your friends group, has fibroids. And there's those who have it and they don't even know. They haven't been diagnosed. So what's my message to you this July? If you have the symptoms that I mentioned, please do find time to see a gynecologist. Let them investigate you, examine you, and so that we know if you have it or if you don't have it. If you don't have it, well and good. Good for you. If you have it, there's ways that they will counsel you and they'll help you prepare for your future fertility, and your quality of life will improve, so to say. So you guys, if you're new, please do like this video, share it with your friends, your sisters, your cousins, females in your family. If you're male, send it to your girlfriends and whatnot. If you're new, please do subscribe and like this video, and do leave me a comment, share with me your stories. I really want to know how it is. And let's make sure that everybody who has fibroids does not feel alone. Thank you.